Welcome. In this short video, we will focus on one randomized control trial. Truly, today's short video is about one article that how we can learn from that trial to implement it for our clinical practice. My name is Dr. Farzana Hoque. I'm an associate professor of medicine, currently practicing in the US. So this is a journal club video. I know that we must be up to date with all the recent articles. Either you are a resident physician or you are a seasoned attending physician, regardless of your specialty. So let's jump right into it. This randomized control trial was published in the Journal of Hospital Medicine. This is the trial about discharge in the AM, a randomized control trial of physician rounding a style to improve hospital throughput and length of stay. I believe there are very few physicians who are mostly working in the hospital did not get any text about ED holding. Imagine you are a hospital is taking care of your patient and you are getting a text from your chief that ED has a large number of patients they are holding and they are asking you to discharge before 11 a.m. Do you know that discharge before noon? This is the most cited early discharge goal for hospitalists in the US, according to Journal of Hospital Medicine, published in 2018. So the key question is, can early morning discharges reduce the length of stay and improve hospital throughput? So let's see what did this randomized control trial found. This was a prospective multi-center randomized control trial. They included 3 large academic hospitals. There were 59 hospitalists, both men and women, and almost like 4,500 hospital discharges were included in this randomized control trial. Physicians were randomized into round on discharging patient first or round as their usual practice. So truly it could be their unique style. They could focus on rounding the sick patient first or discharge patient first. The primary outcome of this study was discharge order time. The secondary outcomes were actual discharge time, length of stay, and order time for imaging and other order tests. So they were trying to find out that, okay, in discharge order time, actual discharge time, length of stay, is there any difference? So let's see what did they find in this randomized control trial. The discharge order time, as you can see, it did not show any significant difference between these two groups. What about discharge time? For discharge time, it also was not statistically significant. What about length of stay? Because length of stay, this is a critical point truly across the North America. And as you can see, when they compare the rounding on discharge patient first as well as rounding versus usual style, it did not show any statistically significant difference. So in nutshell, for discharge order time, actual discharge time, length of stay, and other order time, such as imaging test, it did not show any significant differences. So let's analyze, okay, what is the strength and weakness of this study? Its strength, definitely, this is a multi-center randomized control trial. Hospitals were from diverse regions of US. Some of them were from East Side, some of them were from West Side. They had involvement of 3 large academic hospitals. Those are definitely strength of this randomized control trial. Now let's focus on what could be the limitation of this study. As it was done mostly at the academic medical center, we do not know how this result will be applicable to a small community hospitals. They only included adult patients. There are lot of audience of this channel who are pediatrician or family medicine physician who are working as pediatric hospitalist. So we cannot truly apply this result blindly for our pediatric patient populations. The morning census, nobody can predict the morning census. Truly, depending on the morning census, the sickness of the patient, many things will differ because imagine if your census is low, you just got very few new number of patients, you can focus on discharge fast. In contrast, if your list is full of new patients in the morning, some of them are sick, there is no way you can focus on discharge patient fast. So truly, this is unpredictable on day-to-day basis. So in conclusion, this study showed that prioritizing discharge patient fast did not result in significantly earlier discharges or reduced length of stay. You may have read about this perspective that was published in the Journal of Hospital Medicine about things we do for no reason. And authors here mentioned that things we do for no reason, one is discharge before noon. I know that there could be mixed opinion about it. And truly, there could be both sides of this discharge before noon situation. The key question here is that how we can apply this trial to our clinical practice. Either you are resident or either you are a early career faculty or mid-career faculty. We must have to focus on patient-specific discharge goal because every patient is different. Every patient has different clinical situation, social situation. So we must have to focus on patient-specific discharge goals. Secondly, prioritizing discharging patient fast. Sometimes the physicians who participated in this study, they perceived that it was insufficient. For example, if they are prioritizing discharge on some unit and then again they are coming back on that same unit in the later part of the day, it was kind of perceived that they are traveling back and forth and just wasted a lot of time. I know that still there are significant number of hospitals which does not have the geographic rounding. So geographic rounding could be considered for this specific situation. Thirdly, this study highlighted that, okay, when they prioritize the discharge patient first versus discharging in the usual round, almost patient was like left the hospital almost same time. And I believe you will have the situation where maybe you placed the patient discharge order at 11 o'clock, but sometimes they're not leaving until 3 o'clock. So it's not only about placing the physician's order in the electronic medical record. Also, the system-based approach, like ensuring maybe patient has transport, patient's medications are delivered, all the paperwork are done in an efficient manner to optimize the patient flow. So along with that discharge order, a system-based approach is needed to optimize the patient flow, ultimately the length of stay and hospital throughput. I hope you found this video helpful. Please let me know your comments. I truly appreciate your feedback and I read them very, very carefully. I wish you all the best and please like this video, share this video with your friends and colleagues. And I look forward to seeing you in the next video. Until then, take care. Bye-bye.